Luisa.
Okay. Hello, everyone, and welcome to our ninth webinar of this online initiative 2020, a year without public space under the COVID-19 pandemic, which is jointly promoted by City Space Architecture and the School of Architecture at the Chinese University of Hong Kong, and promoted by the Journal of Public Space. I'm the founder and editor-in-chief of the Journal of Public Space, and I'm happy today to have a number of speakers affiliated to University of Auckland, University of Sydney, and the Chinese University of Hong Kong to talk about towards healthy cities in the age of pandemics. The webinar today is intended to present the findings of a comparative study on the role of urban forms in making sustainable, healthy cities, and it is funded by the Worldwide University Network. I'm passing the floor to my colleague, Hendrik Tieben from the Chinese University of Hong Kong, and welcome to all the speakers. Hendrik.
Mm-hmm. Okay, let me just start from here. Okay, welcome everybody. So the title of today's webinar is Towards Healthy Communities in the Age of Pandemics. As Luisa was already mentioning, this webinar is linked to a project that started actually before the pandemics, which is called Analyzing the Role of Urban Forms in Making Sustainable and Healthy Cities, which we launched together with the University of Auckland and University of Sydney, and also partners in Taiwan and in Canada. And then basically the pandemic started, and we kind of started to rethink our work in these kind of circumstances. For today's meeting, we have 4 different speakers and 1 respondent. So we will have Kevin Lau from the Chinese University of Hong Kong. We will have Leigh Wilson from University of Sydney in Australia, Beattie and Kim Dirks from University of Auckland, and also Manfredo Manfredini, who was already speaking also in other webinars, who's basically our research partner also of this project from the University of Auckland. This presentation is linked to our series, obviously, a year without public space under COVID-19 pandemic, but particularly links back to the 3rd webinar that we organized on health disparity and public space. So if you want, you might, those people interested in health issues and public space might also go back to the webinar 3, and in a way, today we are kind of continuing this discussion, particularly because as in that meeting also we have on one hand urban designers and planners, but also experts from the health background in our webinar today. So in this 3rd webinar, we had 1 great speaker, which was Dr. Fan Ning, kind of frontline medical worker, a surgeon, and also the founder of Health in Action, who works with urban poor and minorities in Hong Kong and helps them in this kind of, not only under COVID-19, but particularly also in this crisis today. And in his presentation, he had this quite interesting slide that I reused from his presentation that basically shows here that if we look at basically the right to health, first of all, as an inclusive right, but also that for being healthy, health care, access to health care is only 20%, while many aspects that are very, very important for our well-being and health are not necessarily coming only from the health care provision, but basically are linked to our health behavior and social economic factors, and particularly also the physical environment. And today, of course, we have experts both from the field of the physical environment, but also from the healthcare provider. And basically the idea that we have to work together to make people more healthy and create a better quality of living. Now, I would just want to give some kind of glimpse into the past on this topic, because as we know, and I mentioned also in the third webinar already, there were always links between pandemics and the design of cities. In fact, the whole field of urban planning is very much linked to the fight of epidemics and pandemics. So for example, the first public space in Hong Kong was created after the bubonic plague in 1894. We had, of course, the SARS pandemic in 2003. And people in Hong Kong probably learned a lot from this experience, and particularly citizens in Hong Kong today are quite versed in kind of reacting to this particular situation. But also other urban plans were very much linked to the questions of not only pandemics, but also tuberculosis, but also, for example, the Spanish flu. And it's kind of interesting to see the time, in fact, is exactly 100 years after where we are now, that we had basically in 1918, 19, the Spanish flu that was killing people all through the world at that time. Here we see a picture from the United States. And it was interesting to see that basically 1918 and 19 was this horrible pandemic. And we see just almost directly afterwards these ideas for a new contemporary city of Le Corbusier, who not necessarily referred particularly to the Spanish flu, but to health issues in general, and the importance to basically separate different functions in the city and create better light and air and have a lot of space for social distancing, you could say. This was, of course, a reflection to living environments, for example, in Berlin, the old tenement blocks, and in many other cities, with overcrowding in those tenements and quite horrible living conditions in which disease like tuberculosis or also other epidemics could easily spread. Now, we know that then there were various other proposals at that time. This is another very famous one by Ludwig Hilbersheimer, which is basically trying to separate all the different elements in the city in a way, in a new kind of arrangement. For example, we are talking today, of course, maybe in a different way about how to deal with traffic, pedestrian and cars, living and working, and basically reflecting on situations that, in fact, this film is a little bit later than the proposal by Hilbersheimer, but basically the condition was already described before, or easy to experience, the question of traffic and pedestrian in the city, which also today is again very much in discussion, but the particular solution at that time was basically this one here. Why I show this again is basically because now we have, of course, a discussion how we can prepare cities better for pandemics. And there was, for example, this article in the New York Times, will we go straight back to the crowd? And it's interesting, this author here is basically describing Richard Williams, how in the early 20s, different schemes were done under modernism, and then later also by Oscar Niemeyer. And many of them proposed basically those windy plazas, this kind of very big open spaces with a lot of space for social distancing as one of the answers for more healthy cities. Now I just show this image here of Amoy Garden, which was basically, on one hand, you can say almost a direct follower in terms of cross towers of Le Corbusier. On the other hand, so on one hand actually helped to reorganize density in what should be a more healthy form. But then we also see the complexity of those discussions, because it was particularly this proposal or this particular design that even though it might have had better ventilation maybe in some of the apartments in the earlier cities, had just one kind of technical problem, like the U-tube in the sewage system, basically, or of the toilets, which basically help to spread the germs. So it is kind of interesting to see that basically what was proposed to make the cities more safer, then for particular other reasons actually became a problem during the SARS epidemic, and basically brings us to the question, like, maybe it is more complex when we look at the spreading of viruses in cities and how we should deal with this. So we already see that on one hand that many people now want to get back to lower densities, but interestingly, those kind of urban conditions that look so easy to spread the virus, in reality, when we see the statistics here in Hong Kong, the latest update from yesterday in this survey by Johns Hopkins, still has only basically seven people that died in Hong Kong and only 1,233 cases. So basically the urbanism that Le Corbusier was kind of fighting so strongly against, not necessarily must be so much more difficult, while maybe other plannings that were meant to be better, not necessarily always were so much more successful. Anyway, so today the presentations will all circle around this discussion, basically how we can link physical environment and health. And the four speakers will discuss those points. And we will start the discussion with Kevin Lau, who is a colleague from the Chinese University of Hong Kong, with particularly a background of studying environmental science and in relationship to urban form. So Kevin, I will stop my presentation here and you can start with your presentation.
Okay, thank you, Hendrik. Let me share my screen first. Right, here we go. Oops. All right. Okay. So, okay, thanks, Hendrik, for inviting me to the webinar here. I'm sorry that I'm currently out in the field to do some field measurement today. Although I'm talking about like physical, active lifestyle, physical activity, but I'm still in the car. Anyway, I have lots of physical activity. Right. Today I'm going to talk about our current work, which is an ongoing project about to develop a community assessment tool for promoting active lifestyle, especially in high-density city in Hong Kong as a case study. So as you may know, physical activity is highly related to health, and it has implications on health of the citizens, but also incur different costs of the national healthcare, and not to mention about like the other co-benefits, for example, the environmental benefits from increased walking, cycling, and the use of public transport, so which lead to a reduction of using fossil fuels. And then in the context of improving physical activity, it is important to note that we have to work in partnership to build up a transdisciplinary partnership in order to promote active lifestyles and also to improve the well-being of the community, the well-being of the people living there, and hence the quality of life. So the scope of this study is to understand how the built environment is related to physical activity, and then so for develop a tool for urban designers to promote physical activity in the community. So under this context, we have four major categories that we have to pay attention on. The first is the recreational resources, for example, open space, the provision of greenery, aesthetic of the environment, of the community environment. And secondly, the land use characteristics, how we plan the use of the land use in our city, especially in Hong Kong with a highly dense, compact environment with highly mixed land use. And also the neighborhood form and the characteristics, for example, the street network, even the street lighting, a lot of like environmental qualities that affect, that would affect the physical activity of people, or the willingness of people to perform physical activity. And the last but not least is the community environment, which is more related to the social aspect that we have to explore with collaborating with the scientists and community leaders, that we have to understand the social environment as well, not just the physical environment, but also the social environment. So in our study, we started with a review of relevant physical and social factors, ranging from walkability, which is a very obvious and also important aspect that affect the physical activity of people, and also the accessibility and the availability of different facilities and services in the community, the air quality of the environment, and also other environmental qualities, for example, the visual, noise pollution, and also the acoustic environment. And apart from that, also the street network, it also it not just affect the connectivity, but also affect the microclimate of the community, which is also an influential factors to the level of physical activity of citizens. And of course, that is the provision of open space. Apart from these physical factors, there's a number of social factors that we also have to pay attention on. The first is the connection of the people within the community, and also the level of participation in the community, social participation in the community, and the sense of belongings of people to the community, the socioeconomic status, and even the cultural background, which affect their way of living, their lifestyles, and also the behavior in the of individuals in the community. As you may know, Hong Kong is a high density cities with a lot of high-rise buildings, compact environment, and it is reflected by the level of urbanization in a very limited amount of land. So the built-up area takes up like about 1/4 of the land in Hong Kong. And because Hong Kong is has a very hilly topography, and there are more than 60% of the land occupied by the country parks, which we cannot build there. And it resulted in a high urban density. So yes, you may see here that the average population density in the built-up area, in the urban areas, is about like 27,000 persons per square kilometers, which is an extremely high population density, and not to mention the building density as well. So in this particular environment, we have to pay attention on a lot of environmental aspects. So for example, the small home spaces, the working spaces, and then the cost of accommodation, which is more the socioeconomic side of the discussions, and the approach to enhance the livability of our cities also include to how to improve the existing environment, and also to optimize future development in especially in the new development areas. So it means that there's a need for design tool for urban designers to take into account a number of different perspectives um, in future development to promote the physical activity in the community. So this is the strategic planning document of Hong Kong, the Hong Kong 2030 plus. And then in this particular document, there's a particular section about planning for livable high-density cities. And then within this chapter, then the idea of promoting active design becomes an important policy direction, and also how to promote a sustainable built environment. Yes, yes, yes. Am I? Is it time's up? Sorry. Is there any problem?
No. You can go on. Just go on.
Right. Anyway, so this is the strategic planning direction of Hong Kong, how to include a active design, active lifestyle in the urban planning and design. And then it's also in line with the strategy and action plan to prevent and control the non-communicable disease in Hong Kong. And then to start with the development of the community assessment tool, we study a number of existing tools from Canada, from the UK, from a number of Asian cities as well. And then the healthy built environment include like different areas of urban planning and design, which within each core areas, then we have a different perspective to consider for urban designers to consider. And then all these particular focuses are related to the social well-being, the economic benefit, and then the size of the communities. And then in particular, social well-being is the focus to guide the planning principles of the community. And then apart from that, another Canadian example is the built environment and active transportation tool. So this one is more related to the transportation perspective, but within that it is also related to how to achieve a more active lifestyle by implementing different design strategies to consider different design perspectives. So the objectives of the study is to develop an assessment tool for urban design in high-density cities. And then this tool is also aimed to support decision-making in the community, and of course to promote physical activity of the urban residents through urban design, for example, the open space, neighborhood environment. And then we are now in the starting stage of the study. We completed the literature review, and then started to develop the tools by doing some pilot tests of the existing tools in different urban areas of Hong Kong. And then the next stage, we will to seek for key stakeholders' feedback from the communities, and then to hold these stakeholder engagement workshops to include a wider range of stakeholders in the community, and not just the community, but also government officials, planners, designers from the professional community. And then after that, the draft tool will be reviewed by experts in the view, and then to seek for like potential changes, revision based on the expert advice, in particular in the local context, from the implementation, also the policy perspective. And then with that, we're into conduct the community consultation, which to look for to seek comments, ideas from the community members. And then we will do field testing at the later stage of the study. So we're now doing a pilot test in one of the residential areas of Hong Kong, which is Kwun Tong, in the eastern part of the city. It has a very small community, so you can see here that within 600 meters, then there's quite a wide range of urban settings, from the more local or older local style with tenement houses to a newer generation of public housing in the community. And then with that, we found that the existing tools, there are some deficiencies that they do not consider. For example, the obstructions on the sidewalk, which is very common in the old urban core, especially in the wet market areas. And also the traffic congestion because of the mixed land use with the transportation land use and the residential land use in the same area. And the poor quality of the sidewalks, that we know that this may potentially cause to discourage people to walk in certain areas. And also this is very specific in Hong Kong, that we have a lot of upper level activities on the podium of the buildings in Hong Kong. So all these are some specific features that we found in our city that may not be considered in the existing tools. Then we'll in the next stage, we are now we will work on to improve the tool to adapt the tool to our city, and to develop a set of assessment tool and corresponding design guidelines with the collaboration with the professional community. So this is my presentation, and I hope that you will provide some valuable comments for our study to further. Thank you very much.
Okay, Kevin, can you stop sharing? Okay, thank you very much, Kevin. And I hope later in the discussion we still can go back to Kevin, because also maybe to see how the relationship is between those kind of contemporary studies that you're doing at the moment, and on the other hand to see like how much they are linked to your experience in Hong Kong under SARS, right? Because I remember, I think you were in the city at that time, and there were a lot of studies that were basically directly done after SARS, and it could be interesting to see like how this kind of new work, which also has a lot of link to community aspects and social behavior and so on, which seem to be very important and also probably very much missing in those kind of first images that I showed, that of course, when we want to find quick solutions, we probably have to reflect on the complexity of urban conditions. Now I come to the next speaker, which is Leigh Wilson from the University of Sydney. So Leigh Wilson is an expert in the field of public health and is at the moment a senior lecturer for behavioral and social science and health at the University of Sydney.
Thanks, Hendrik. Share my screen here. Okay, so what I'd like to do tonight is just to give you a bit of an overview of the way we've experienced COVID-19 in Australia. I know probably you will have heard a lot of this already, but I'd also like to just go through a few of the issues that were raised in a very small study that we've just started, and just some very preliminary results as to how COVID-19 impacted upon the well-being of our population, with particular reference to the use of public space. So just a bit of a way that COVID-19 unfolded in Australia. The Australian Director General of Health actually declared the outbreak a public health concern on the 30th of January, and it wasn't declared a pandemic until the 11th of March. During that time, I truly believe that in fact the Australian population thought they were pretty much immune. There was not much mask wearing, and people were certainly not social distancing at that time. Around about the 15th of March, the Prime Minister actually stopped all incoming seacraft without health approval. And so that there were a number of cruise vessels that were stranded off the coast of Australia for quite some time, unable to disembark their passengers. However, on the 18th of March, we did have a cruise ship, the Ruby Princess, was allowed into Sydney to dock, and there were a number of people on that ship who were experiencing fever. It is currently under investigation with the Royal Commission because the passengers were allowed to disembark without having any testing. It was felt by the medical staff on board the ship that most of the people would probably have had some sort of viral illness or influenza, and they were very unlikely to have COVID-19. What actually happened from that is that the ship really has become the epicenter of Australia's coronavirus cases. And as a result, we've had 22 deaths from that ship alone, and more than 600 confirmed cases, including a lot of crew members as well. And the reason that this has sort of occurred was because the passengers on the ship were from all over Australia. A lot of them were also international passengers. So they were allowed to disembark and then travel on aircraft and by road. And therefore, there was a lot of community transmission. So we decided that we would do a small study to, actually I'll talk about our current status first. So this is our current COVID status at 30th of June, which is just a couple of days ago. And we've had 7,800 cases, and we've had I think 104 deaths. I can't quite see that there. Yeah, 104 deaths in total. We've currently got a spike happening in Victoria, which is one of our southern states, and they had 64 cases on the 30th of June, and they've subsequently had 75 and 72 again today. So this is still of quite a great concern, the number of cases that are happening in Victoria. And you can see here, though, that in terms of all the different states, New South Wales is the highest here with 49. And then, of course, down here, these are the deaths that we've had in total. So overall, we're doing quite well compared to a lot of countries in the world, but this spike in Victoria is currently quite a concern. So we decided that we would do a study to look at the impact on well-being in the community, with particular relevance to various age groups. We developed a de-identified online survey, and it had the opportunity for participants to include free text about how COVID-19 and the lockdown in particular was impacting on health and well-being, but with a particular focus on things like access to the environment, how they were feeling at the mental health with relation to working from home, some of the challenges and benefits that they were experiencing. So within that online survey, we asked quite a lot of demographics, for example, housing type, access to local services, lifestyle behaviours. We've also looked at mental health with the Kessler 10 and the short form 12, and we had some COVID-19 specific questions. And we had that approved as a rapid approval process by our Human Research Ethics Committee. So this has only been going for about 3.5 weeks, this study, and we're aiming for at least 250 participants. We've currently got 105. 80 of those are women and 25 are men. Interestingly enough, and this actually really, it surprised me at first, but in retrospect, I think it's perhaps not surprising. Women aged 18 to 25 made up 30% of the total sample. And I think on reflection, that's probably because we did a lot of recruitment through Twitter and Facebook. So that's probably this sort of age group here that's using that. So in this younger age group, this is our start-off age group, we had 30% of women and only 4% men. And the second highest group of respondents were the 54 to 65 age group, where we had 11% were women and only, again, 4% men. And within those other age groups, the distribution of men was quite similar. There were similar numbers in each category. We looked at the anxiety levels in all the subjects, and we found that across the board, in the women, around 49% of them said that their anxiety was higher during the lockdown. 21% had no change, and 7% said theirs actually decreased because they weren't at work and they were much more relaxed. And in the men, we had 10% with a higher anxiety level. So overall in that 60 group of 60 people, it was around about 57%. We looked at exercise and access, and around about 33% of women said that there was much less exercise that they performed while they were in lockdown, and only 22% said they increased their exercise. And this is in, I suppose, in contrast, because we actually, one of the directives from the government was that we were allowed to leave our home to exercise, but the exercise was only walking because all the public spaces were closed, all the gyms were closed, and anything else that was able to provide exercise, for example, in group settings, was all cancelled. So the only exercise that was available was either home-based exercise or external walking. So looking at some of the free text responses, they were actually quite interesting, and it came out that really people felt they were working much longer hours by working at home. It was very difficult for parents to juggle this homeschooling of their children as well as working from home and trying to fit in exercise. A lot of them said that their work was supportive, but it was very difficult to homeschool children. And in New South Wales particularly, we didn't close our schools. We allowed the schools to remain open, but the parents had the discretion to either leave their children at school or take them home if they wished. And what tended to happen mostly was that they kept them home if they could. It was only if they were working as an essential service and had no childcare that the children still went to school. But a lot of them did talk about the fact that they couldn't go out to play. The children could only play at home. Many of those, of course, particularly if they were in high-rise buildings, had very little play space because all the public play spaces were closed. They did talk about doing the bear hunt, and I'm not sure, I know they did this in New Zealand, but I'm not sure whether you did this in Hong Kong. And this is where homeowners would put a teddy bear in the window. I'll just flick to that one. So a teddy bear in the window here, and the children would go for a walk with their parents to spot the bears in the window. And that was something that they found that was actually quite enjoyable, and the children enjoyed as well, which they could do exercise with. This is just a photo of the play equipment all screened off, and this is actually quite mild. In some areas that I've seen, there was so much screening off that you could not have even possibly got remotely close to the play equipment. So they were very, very strict about that not being used. So I'm going to leave it there. I think if you've got any questions, I'm happy to talk about them. I'm very keen to see some more results as we start to analyse it in a lot more depth, particularly some of the scales, mental health and wellbeing scales that we've used. But I have only had a preliminary play with that data. We've got a big blitz on at the moment to recruit a lot more men and a lot more people. So hopefully I'll be able to get back to you before too long with something a little bit more meaty. So thank you.
Thank you very much, Leigh, for your presentation. And I give the word to Manfredo, who will basically introduce our next two speakers from Auckland. Yeah. You're muted. Manfredo, you're muted. Sorry.
Yeah. Oh, thank you, Hendrik. Yes, and we are here in Auckland. Is actually a team, part of this Worldwide University Network project that was introduced at the beginning of the webinar, and is actually a network that has expanded quite significantly over the time, because the fact that with the COVID we couldn't really meet and develop things as in the original project, we were allowed really to embed in this project much further other things and extending it over time. So we have a few people, but of the group, of which of course I'm a member, we have now two people that will present their view on these particular issues, and in particular showing and discussing what this condition, the situation that we have with COVID has brought about. And the first will be Leigh Beattie, and what is quite what I want. Libit is a colleague of mine at the School of Architecture and Planning. He's a practicing urban designer and urban planner with 25 years of experience, professional experience, and is the deputy head of the School of Architecture and Planning and director of the urban design program. He's also working beyond the pure scope of our institution, and he works also for the community. And in particular, he's chair of the Auckland Council Urban Design Panel. Now, his presentation will discuss and look at the opportunities and challenges for urban growth, and the role that urban planning and urban design could play in a post-COVID-19 era. So he will look at how some particular situation that, starting from the experience in New Zealand, can help creating more local resilient communities with higher active travel options, and how can we redesign our neighborhoods. So Leigh, please.
Well, thanks, Manfredo. It's really good, and thank you very much for the opportunity to speak along Hendrik to speak today. What I'm going to do is I'll just go through something which is a bit down of a knockdown version of something that I gave to a presentation to the local members of the urban design and urban community and urban planning community here in New Zealand. And yeah, we did have the bear hunt, Leigh. Yes, we had the bear hunt. My kids were doing that all through Auckland, so that was very good. What I'd like to talk about is that COVID-19's had quite a huge impact, obviously, across the world. And New Zealand, I think, and maybe a little bit better than Australia, and no disrespect to my Australian colleagues, that life in New Zealand has pretty much returned to normal in a normal sense. Today, I was actually in the South Island of New Zealand. I was in Queenstown, where it's very cold. It's actually cold here in Auckland, and I could just travel freely. There was no restrictions on the plane, and I just flew straight back from the south of New Zealand back to the north, where I'd been working down in the South Island, and things have slowly returned to normal. But I'd like to talk about some of the things that we could do and some of the opportunities and some of the barriers that we've had and what's come out of this COVID-19 for me and a lot of other people, is to talk about what we could do in these professions to try and improve the quality of our outcomes, public health, public spaces, and the public realm and growth management in all together. And I think that we do a lot of talk in New Zealand about these types of things, but unfortunately we don't seem to do very much of this in some ways. I mean, things are getting better, but I think this is what I'm trying to say, is this is a really good opportunity for us to do this and return to the concepts of local neighbourhood creation, the idea of actually creating livable and walkable communities with active travel options, and not needing the whole idea of commuting and such like. It's not a new concept. This is a map of my hometown, and these are some old planning maps, which I won't bore you with, but they go right back to 1974 when we really started to work on growth management. And if you could look at these maps in detail, and I won't bore you with it, but you could see that over the preceding sort of 30, 40 years, we've put out all these ideas of growth management. We've talked about all these types of things of trying to consolidate around centres, around transit types of things, you know, the Todd-orientated development. But we just constantly don't really do it that well. We just keep expanding out of the periphery and such like. And it's really interesting when you look at these, that how much land has actually gone into that space. And so I'd argue that, you know, we've talked about this a lot, and I'm going to talk about the hometown that Kim and Manfredo and myself live in. And Auckland is my hometown. I was born and bred here. But a lot of what I'm talking about now would apply in other parts of New Zealand. As I said, I was in the south of the country today working on some of these exact issues. What I'd like to see is think that this could provide us with a fundamental opportunity for change. I think the worst thing that could happen to us in New Zealand, and I think this goes globally, is that we just go back to the return to the business as usual. And I'll talk about that quickly at the end, because there's a lot of pressure in New Zealand and all around the world. You can see that in the US, you can see that in Europe, you can see it wherever you like, to try and get the economy moving and all those types of things. And I think in many ways what happened in New Zealand, we had a loss of liberty for 6 weeks. It was quite an intense thing where we weren't allowed to go out apart from the supermarket. That was it. And we could walk around the streets, but only in our local environment. We couldn't go anywhere else. And I think that has paid off. It has given us a scenario where, as I say, where it's pretty much almost coming back to life as normal. But I think that as professional groups, as urban designers and urban planners and architects and landscape architects, we've got to show leadership in this space. This is my high street. This is not far from where I live. In fact, it's 5 minutes walk. And this is the day just before lockdown ended, and there's basically no cars in there. And if I showed you today, it'd just be full of cars and people, but then there was just nothing. It was incredible. You could walk on our streets, you could just take them over, and you go to the local park, and I'd never seen our park so busy with people in them. And let's say people didn't worry about traffic. They just walked over the streets, they rode their bikes and just did their thing. And we'd like reclaim the streets. It was actually a really, really cool experience. But I think the thing that I think this has brought home to a lot of us is how unresilient many parts of our urban systems were. It highlighted the underlying problems that we've had in our society, you know, in New Zealand society. And I'm just not us, I'm sure it's, as I say, a lot of the things I'm talking about are really, I'm sure can resonate with you in your own spaces in the US, America, wherever, Asia, wherever. The issues of housing affordability, homelessness, equity, you know, access to technology. It was very interesting as a university when everything went remote. We all went onto Zoom, and I never want to do that again. I never want to teach a studio on Zoom, but we all went that way. But it raised this whole digital divide and who has access to technology and who has access to high-speed broadband to actually run all these sort of things. So it was really interesting. The cost of social dislocation really came out, and I say that loss of liberty just reinforced the dislocation of people and things like that. I thought was really, really, really interesting. Issues of food security, all those types of things, brought to the fore why are we allowing people to build housing on high productive soils, you know, when we talk about food miles and all those types of things. All these sort of discussions came to the fore and just showed how unresilient our system really, really was. And this is the thing that we were talking about, is that a lot of the urban planning documents, when I'm afraid I was talking about growth management and looking at those things, and I showed you those plans originally about how we've talked about this type of stuff. But apart from a few examples, and things have changed over the last sort of 15 years, I think things are getting much better. There's a lot more intensification, a lot more thinking about quality of design, a lot more of those types of things have taken place in Auckland and throughout the other parts of New Zealand. But we've really talked about these concepts of deliverability, but we really haven't really delivered it that much. And still the evidence is there. We're still developing car-based cities. And what I think for us is a really opportunity is to take this thing and say, let's do what we've talked about and create resilient, sustainable communities where people don't have to commute long lengths of terms. We don't have to rely on things for the things we've just talked about. I mean, you know, and for me, urban design, urban planning, you know, all the built form professionals are about normative behavior. And if you design, especially in what we've been doing, is designing for cars, well, that's what you get. It's, you know, it's normative behavior. So if we've got to start changing our behavior and then actually coming up with the visions and then start delivering on those and actually delivering meaningful outcomes that will actually bring us back to the space that we saw through that COVID lockdown period over 6 weeks, where we really couldn't go anywhere apart from walk. And I mean, our local neighborhood, we really couldn't go outside our suburb. That's what we were limited to. If you went any further than that, the police stopped you, you were in all sorts of trouble. So, but it just, as I brought back that we could, if we could think about living like that, and what we've been talking about would be really, really cool. Some of the problems that we have, though, is that we still have this underlying desire for single detached housing, and that typology change is changing. But I think we really haven't talked about the values and trade-offs that you get with quality open space, you know, and quality resilient communities, quality types of things. We really haven't talked about that in a meaningful way to bring those sort of things forward for us to think of. And we haven't fully explained those trade-offs. So that people, the average, you know, I hate using that word average, but the average person go, oh, I know what you really talk about. There's also, I think, a lot of other issues to think about when you do talk about the cost of land values, the cost of construction. And unfortunately, in New Zealand, it's just incredibly high. It costs 30% more to build a house in Auckland than it does in Sydney. And that's just to do with economies of scale and some people making, you know, there's a lot of people making a lot of money out of the system here. And so there's a lot of other underlying tensions that go on with that. So, but, you know, and we also have to be concerned about the whole issue about if you do start talking about housing affordability, the last thing you want to do is then distort your whole housing market and the whole lot of people going into negative gearing. And I think that's the other thing that's come out of COVID is how unresilient some people were. I mean, we had some businesses that shut down for 6 weeks and will never come back. And it just shows you how unresilient in many ways and how reliant they were on certain things. So we do have to be careful about those types of things. I think there's a really interesting thing that you're starting to see in New Zealand now is that we're moving away from a more neoliberal type of system we never really had that in many ways. It was a very socialistic version of neoliberalism in New Zealand. It wasn't the classical sense, but we're moving away from that more to the role of the state. And you can see a much more stronger role in the state in intervening in housing supply, infrastructure supply. In one way is to try and get the economy going again and keep it, you know, it's really interesting today. The data is coming out that unemployment's not going to be as high as I thought it was going to be. Economic GDP is not going to go back down as much again because the economy is starting to go. But again, the state is starting to intervene more into housing supply, especially in dealing with those more vulnerable people, which I think is one of the positive things that can come out of that. And they say, but part of the problem with that is, again, like the housing issue, housing construction industry in New Zealand is not big. It doesn't have the economies of scale that you get in the US, the Europe, and obviously Asia, and you would get in Australia. So it's a really interesting thing for us to think about. But I think there's a really interesting opportunity for us as a professional groupings and for the university space as academics is try and capture this narrative and talk about what this is giving us the opportunity to revisit these things and actually deliver on these things that we've talked about for so long and actually think about developing these resilient communities. But what worries me, as I say, is we can go straight back to the status quo and we just think about economic growth over all the things that we really should be thinking about. And that does worry me that we're starting to do that. And you can see that with some legislation. The New Zealand government, in New Zealand, we just have one government. We don't have states or anything like that. We just have one central government. And it's introducing new fast-tracking legislation to fast-track planning projects that they deem to be important to just get the things going. So it's a really interesting concept. But I think what I'm trying to say here is there's a really big opportunity that we can capture from what we had from the space that we're in to try and value these types of things, capture that narrative and try and encourage people to move forward to develop these types of things and deliver on these promises that we've always wanted to do. So I think there's a really strong role for us in the university sector and in the professional sectors to stand up and show leadership in this space and stop the narrative being captured by the usual things about economic growth. And I think that will be my 7 minutes. So that's what I wanted to say. Thanks very much. It is a cold day here in Auckland. It's a cold night. It's about coming up to 10 o'clock at night. But thank you very much for the opportunity to speak tonight. Thank you.
Thank you very much. Thank you very much, Leigh, for giving the time especially. And the other team member of our Auckland group is Kim Dirks. So she's an expert in environmental issues. So she just moved and changed department from the Department of Medical and Health Sciences to the Department of Civil and Environmental Engineering. And at the moment, her main focus of research is the ways in which urban environment impact on health and well-being of urban residents, particularly with regard to urban pollution and environmental noise. So what should we be talking about today in this short presentation is something that is part of the research that we are doing for this WN network. And it is particularly with the response to COVID-19 issues, when essentially, as Leigh showed, there was a very strong restriction in mobility and the streets were empty. So all of a sudden what happened is that there were only a few people moving, going for essential services. And these encouraged a completely different behavior of people. Indeed, in Auckland, I think it was impossible to buy a bicycle at that time, not because shops were closed, but simply because we're all sold very, very shortly. And so cycling, running, and walking became particularly important, and therefore the question of air pollution in the urban environment became probably something that all of a sudden changed completely the perspective. And now we will see how, probably looking forward, we can learn from this experience to rethink and reshape our cities. Please, Kim Dirks, the floor is yours.
Thank you, Manfredo. Let me share here. Okay, hopefully you can see that. Okay, so thank you very much. So this talk is being presented on behalf of Ben Anderson, who's a colleague from the University of Southampton, and also Vincent Dirks, who did the coding for the modeling work. So what I'd like to do is talk, basically just give you one slide looking at an international example of air pollution, one on the local context in New Zealand, and then talk to you a little bit about the model that we developed to have a look at air pollution levels as a result of COVID in Auckland. Hopefully, okay, so here's my one international example here. So this is, I mean, no doubt many of you will have seen all these articles that came up in the newspaper that we're looking at that showed remarkable improvements in air quality during the lockdown period. And this is just one in France that was showing the levels of NO2 from a satellite called Copernicus Sentinel. And it basically shows what the air pollution levels were like in March, the year before lockdown, and then comparing to what was happening during this year. And so there's quite a few of these types of figures that have been appearing in the newspaper. And it really certainly highlights all the significant reductions that occurred in air pollution levels during this time. So there's been quite a lot of work all around, either looking at satellite images or looking at surface air pollution levels. And often people were saying, you know, air pollution levels have dropped by 50% or 60% or 80%. And often it was comparing to previous years at the same time of year. And of course, this particular environment was great in terms of, you know, presenting a large sort of what-if scenario associated with air pollution. In New Zealand and in Auckland, the situation was very similar. We went into lockdown on the 25th of March. And at this time, so this is an example of the city centre in Auckland. So everyone was required to stay at home. We could go out only, certainly by car, only for the purpose of essential services. Schools were closed, travel was restricted. So the traffic on the roads was considerably reduced compared to what it would normally be. At the same time, people were very much encouraged to go out and exercise, as Leigh mentioned. So that was something that people were told that was important to do in terms of mental health reasons. It's actually quite hard to know whether people were exercising more or less. So it's great that you've been doing that work, Leigh, in terms of surveys, because it certainly looked like on the streets when you went out that there was far more people than there normally are. But of course, they're not going to gyms, they're not doing those other types of sports that they would otherwise do. So there was cycling, there was running, and there was walking, but there wasn't much else that people were able to do. But certainly a lot of people were out, a lot of them trying to obviously ensure that they obeyed the rules of social distancing. And so pretty much because of the low traffic flow rates on the streets, everyone was actually walking down the street because the footpaths definitely were not adequate in terms of allowing for the number of people that wanted to be using them. So rather than being closed, the streets were very much alive. I mean, it was actually quite fun to be going out and walking down, you know, the main road that's normally quite a significant arterial and sort of take over that space. And I actually rode a bicycle for the very first time in a very long time. And that was really fun. And I felt quite safe in doing so. There were a lot of comments that people made in terms of the improved soundscape during the time. So people commented the fact that you could actually hear lots of birds about and the wildlife and things that you wouldn't normally be able to hear nearly as well. And people also commented a lot about the improved air quality. And particularly, I think the people with asthma and other breathing conditions, they said, hey, it's so much easier to breathe. Whether it was genuine or psychological, I don't know, but they certainly commented on that. So like I said, lots of articles in the newspaper saying air pollution's gone down by 50%. This one here said 90%, so different estimates were made. Some of these were done based on satellite and some of them based on surface measurements. So while these are a reasonably good estimate of the reductions that were observed, of course, air pollution is very highly dependent on the surface local meteorology. So it's very hard to tell by just actually looking at the observed concentrations, you know, how much of the drop in pollution levels are caused by a drop in traffic flows and how much of it is caused by the fact that it just happens to be conditions that are conducive to lower air pollution. So for example, it might just have been a windy few weeks and the air pollution was low because of that. So it's really hard to get some reasonable sort of quantitative estimates of these types of things. So this is where the model came in. So we went about applying a model that I developed some time ago that essentially takes information about the wind speed and the wind direction and historical data associated with air pollution and tells you what you can expect the air pollution levels to be, assuming the traffic that it has been historically. And so what we did was to run this for the period. Okay. So essentially, this is the model. It's almost about as simple as you get in terms of an air pollution model. So it's called a box model. So essentially the wind comes along and pushes air across a box. The cars emit the pollution into the box, and it's then distributed evenly within the box, and then the wind sort of pulls it away. So depending on the traffic flow and how much air pollution is produced in the box, and the mixing and how quickly that moves through because of the wind speed, you can predict what the air pollution level is going to be. And then you optimize that. So the idea is you look at the traffic flow at a certain time of day, compare it with the concentrations, and you run regressions for different times of day, weekends, weekdays, and also split the data into upwind and downwind depending on which side of the road or which direction the wind is blowing in. So essentially the model consists of a series of regression parameters for different times of day and different wind directions. So essentially what we did was we optimized this particular model for 2019 for the correct time of the year. And so we had a model that would tell us what the air pollution levels could have been had the traffic flows actually been normal during the lockdown period. Okay, and so, oops, there we go. So this is just an example of the model being run. Actually, it's for a site in South Auckland, and this was a few years ago now, probably 7 years ago. So it's a completely normal situation, but just shows how reliably the model can actually predict air pollution levels. So the first one shows NOx, the second one is carbon monoxide, and the third one is PM10. And so the gray is the observed concentrations and the red is the predicted. So we've got a fairly reliable way of being able to train up a model to be able to tell us what we would expect the air pollution levels to be under normal conditions. And so this is what we came up with in terms of concentrations for the lockdown period. This is for a suburban site on a fairly main arterial in Auckland. The top one is black carbon and the bottom one is NO2 concentrations. The red line represents the time when we went into lockdown. So essentially the 3 weeks leading up to the middle of the graph are periods where essentially traffic flow was normal. And so we'd expect to get a reasonably good match between the observed and the predicted concentrations. So in this, the color I've used here is the dark blue is the observed concentrations and the light blue is the predicted. So pretty much for both of the pollutants, you're getting a reasonably good match leading up from the beginning of March to about the 25th of March. And then after, so about the 25th of March, we went into level 3. So things started getting a little bit funny the couple of days before we got to March 27th. And then from 27th on, that's considered to be lockdown period there. So this is what we got, and what we can see here is that certainly from the 27th onwards, and I've only taken it up to, I'm obviously a little bit behind here, 17th of April, so I'm going to be extending that once I've got the updated data, so I've got distracted with other things in the meantime. But clearly we can see some significant drops in terms of observed concentrations compared to what we would have predicted. So had the traffic flow been normal, we would have expected the dark blue line to match up with the light blue line, and clearly that's not what we're getting here. So definitely some significant reductions, and from that we can get some statistics which will tell us reasonably reliably how much of a drop in concentration we would have gotten. So interestingly enough, I would expect now that the levels, we haven't got the data yet, but I would expect the levels to be pretty much back up to normal. If you go around Auckland, you know, the traffic flows seem to be what they always were, I guess, before the lockdown, which is a bit unfortunate. There's still some people working from home. So I think at university, rather than having everybody in 5 days a week, I think people are, I don't know, Leigh, what you think the proportion is, but I think probably maybe half people are back now, or people are tending to work, you know, 2 or 3 days instead of trying to work 5 days. I don't know whether there's anybody who started cycling during lockdown who is still continuing to cycle to work post-lockdown. I'm not sure about that, but I do fear that we're going to end up going back to normal pretty quickly, and that those air pollution levels are going to head back up again. But let's hope people have thought a little bit about how pleasant the environment was, you know, when there were less cars on the road, and perhaps some people will have converted in terms of their mode of commuting to something a little bit more sustainable as a result of all of this. So thank you. That's it for me. Thanks very much.
Thank you very much.
Manfredo.
Yeah, so we still have a little bit of time for discussion. And to start the roundtable discussion, I want to ask Manfredo, who was basically listening to all four presentations, to respond to the four presentations that you have heard and tell us your different perspectives, what you observed.
Oh, sweet, yes. Thank you for inviting me to do that. We've seen very different approaches to the topic, and I guess that the point that it was made very important is the multidimensionality of this particular relation between space and public health. And this multidimensionality, which was introduced by Hendrik, reminding to going back to the first webinar, the second webinar that we had when we discussed this particular issue, particularly looking at health and medical questions, is exactly highlighting how in reality we're looking at phenomena that go much beyond the strict aspects of health that we can consider, in particular not only the social economics, which apparently are the most important, and we see immediately from what is happening nowadays in around the world how these social economic issues are strongly related, not only in general to health, and even in New Zealand, there's a strong correlation between the socioeconomic difficulties and so let's say socioeconomic inequality and health inequality among population. But we've seen particularly now this extreme situation during the coronavirus crisis, how this particular relation is direct and exacerbates the results. So as we presented 2 weeks ago, the result of the 1 week ago actually, the result of this workshop that we done on New York, we clearly were able to see how in particular areas where the highly problematic development of the virus spread were actually the one that socioeconomically are the less fortunate. But what is important, I think, is also to really look at the entire question. And I think that today we covered the different aspects, and the different aspects were really very much elaborated, starting from Kevin, who were really looking at how this has to do with questions that are much more complex and not only involve these aspects, but in particular the culture and the societal aspects, the societal question factors. And this is quite crucial because we tend to not really consider these aspects, but in reality, when we look at what is happening in cities, and I like, for instance, what Hendrik showed in the beginning, at the difference in which we might perceive a space in terms of being at risk or being conducive to, in this case, the spread of viruses, but at the same time, we appreciate its vibrancy, its density, its intensity, and possibly also we understand it how in some particular environment over others, and I'm thinking now the streets of Hong Kong that Hendrik compared, we see a capacity really to go beyond the pure planning and the design of cities to really allow for communities to develop their capacity, their social capacity, the economic capacity. And we know, for instance, that one of the most important questions now in China, which is under discussion, is how to address major problem of unemployment. And we know that there's this particular reaction in the creating possibilities for microeconomic development with markets or with second-hand or very simple things happening on the public realm, which is actually looking at developing or providing a temporary response to a major question, major economic question, unemployment essentially. And this is something which really we haven't seen before. But going ahead with the other question, I'm particularly interested also in what Leigh presented looking at the question in Sydney. And this is quite important because the question of the mental health is one of the key ones. And this has to do with something which applies to an incredible, had a particular effect directly on well, fatalities in this particular period of the COVID. So there's something which we can hardly explain looking at the data, which is the difference between, say, the baseline of mortality, particularly in the elderly group, and the incredible peak and the incredible increase of mortality that we have, which is way beyond what we can attribute to the role of COVID. And I know because I'm Italian and I'm constantly talking to people in Italy, what is the main problem of elderly people? And one of the main problems is exactly isolation, loneliness. And this has to do exactly with mental health in first and foremost. And this has huge implication on all the other aspects of personal health. So, and I think that Leigh was quite right in identifying, even if I guess that as we see in the data she presented, there were not many in the say elderly group, but she highlighted how even in younger generations, this is a very crucial dimension, a very crucial issue that we have to deal with, we have to understand. And to deal with it, I think that Leigh gave a clear interpretation on how we really need to understand things differently. And looking at the case of New Zealand, in which we really try to do our best, I think, to guarantee a sort of sustainable development of the city. And we are relatively fortunate, even in the case now of the COVID, of having a great environment and not having other problems that we have seen in, for instance, in the cases like Hong Kong related to density. But in reality, what we see is that most of the things that we have pursued in the last 20, 30 years has not necessarily been delivered as they were. So this question of the management of the growth, urban growth, is something that is particularly complicated in our part of the world. And in this case, we are very similar to what is happening across the Tasman Sea in Australia. And what we are building is actually cities, models of cities that have really problematic question of community resilience. And this is something that we need really to readdress differently. And I think that moving away from well, what Leigh defined the soft neoliberalism, but I have to say that coming from Europe, I don't find it that soft. But anyways, moving away from it, I guess that what is really happening and we've seen during the COVID period is an incredible attention to try to minimize or do whatever possible to reduce inequalities. And what we discussed also a few weeks ago, talking of the Auckland case, was that incredible situation in which, differently from most of the cases in which we have seen the virus spreading around the world, in New Zealand we had a very selective social group that was affected by it. And these are the young, these are the affluent, and these are the urbanites. So that's something that is quite unique. And this probably has to do with the policies that were taken from our government, that possibly in a completely different way than other countries, which are absolutely hardcore neoliberal, starting from the US. What was done here in the very beginning was really looking at people well-being over probably business, and that's what probably the government is doing now, maybe with a bit of a delay, but is was really something that allowed a completely different pattern of the distribution and development of it. So I guess that this is exactly what the takeaway of the COVID. So we really need to focus on other things, on other ways of addressing the question of how we build cities and how that has to do with public health and whatever it is, health in this multidimensional condition that I was talking about before. And in particular, I think, again, looking at the mental and cultural aspects that are very key to reestablish elements of integration and the question of relationality, relation to place, relation to culture, relation to the society is something that we really need to refocus on. And the sort of abstinence that we have had, well, in New Zealand, as was mentioned, we are luckily in a situation in which possibly at the moment we can't really figure it out how we were in just 1 month ago. But this is something, this negation of the relation to people and places is something that really made us rethinking at modern and patterns that of course have a lot to do also with what Kim reminded us, that possibly what is happening there is that we can absolutely rearrange, rethink, and re-inhabit our cities, possibly not cycling when it's forbidden, because today our Minister of Health has to resign because actually he was cycling, went to beaches and so on during the lockdown. But beside that, having said that, we really all appreciate this incredible city. I live in the very central area of Auckland, and I have to say that it was never so beautiful and quiet to be even looking out to the street. So that's, I try to give a larger picture, my interpretation of the speakers, and I would like now to open the roundtable and give back to Hendrik, the lead on this. Thanks.
Okay, thanks very much, Manfredo. Maybe at the moment, we don't have yet a question from the audience, so maybe you can still raise questions with a Q&A function. So therefore, maybe I come up with a question going back to Kevin's presentation, because I think Kevin, as you have seen, basically tried to develop a quite comprehensive toolbox, basically to evaluate healthy communities, and with that also reflects quite well, I think, our spirit when we started this WOON project to avoid basically those images that I, for provocation, I showed at the beginning, which of course nobody would really propose that now, but still to see like how can we really avoid simple answers and really understand the complexity of city planning and health with all those different social and health aspects and so on. Now, Kevin, you didn't say so much about how that is now reflecting basically the experience of COVID-19, or even maybe experience that you had before as somebody who worked, I think, after, of course, long time ago that SARS happened, but I think you worked in a particular group in CHK that was working on many aspects of air quality and so on. That was basically set up after SARS, so there's a certain kind of line of investigation. Can you say a little bit more like how this work reflects maybe the particular situation in Hong Kong, or how that relates to the COVID-19, and how do you see it because of COVID maybe go in the same or a different direction there?
Yeah. The experience from SARS is one of the reasons for the rapid spread of the disease is the compact environment. And since then, we have developed the government developed the air ventilation assessment, which guarantees certain level of air ventilation within our city. And I think like somehow the urban environment somehow improved quite a bit. For example, you don't see any more what we call the wall buildings in Hong Kong, and then we see more ventilation corridors in the newly developed areas, and you see more gaps or voids in buildings, which actually complies with the design guidelines. I mean the local design guidelines, which aims to improve the permeability of the city. Of course, like to enhance the air ventilation. But I do think like for the COVID-19, I mean the pandemic this year is more related to the people, how we perform social distancing. As you can see, like quite a number of outbreaks in different countries is due to the people crowding in certain areas, people gathering in certain areas, but not really due to the design of the city. But of course, like how we accommodate this change in behavior, I mean, in the future, as you may also notice that even in Hong Kong, the situation is a little bit better than a few months ago. Then you see people's behavior changed quite a lot. Even if they're in the park, then they tend to stay further with each other. And then some arguments that we have in the past, for example, the small parks in urban area, are they still an ideal form of park development? I think that is open to our discussion. And I think this is also related to our development of the tool for physical activity. Is the availability or the amount of green space or open space may not be the only reason to improve physical activity. Instead, we need to consider people's behavior and sometimes maybe the social and cultural background of the citizens. So I think it moves one step forward from the design of the physical part of the city to including more social dimensions.
Mm-hmm, mm-hmm. Yeah, I think that is also probably the kind of intersection point between this earlier work and there was PhD, particularly our school, and also other line of work that we are doing. Yeah, I felt like one interesting point could be because I think obviously it's very meaningful to have this relationship of all those different factors and in an ideal world, right? And you said already that there were like certain points that were actually included into even in outline zoning plans and so on, and were actually implemented to a certain degree in terms of the building form in Hong Kong. But I think for some of the social aspects, it might be more difficult to actually change behavior and also to work with a particular economic environment, right? One question would be that would basically link Kevin's work with that of Beattie, because I think you were also showing a quite comprehensive perspective, right? But I think because of your experience in planning practice, right? You were saying it. Hopefully, we won't go back to as it was before, and we see basically in Kim's work also that basically there might be maybe very easily it just goes back as it was before anyway, right? To let's say with a certain kind of more not so welcomed patterns, right? Of course, there are changes in terms of many economic problems and so on, but in terms of the using this as an opportunity, this is a different question, right? So Leigh, what do you think could be ways, let's say, if one would use Kevin's toolbox, basically, right? How could we implement something? What could be the kind of mechanisms to do this, or where, or otherwise, where are the biggest roadblocks? I mean, it's very difficult to have a solution for everything, but maybe also to define what are the biggest roadblocks. I know that's a difficult question maybe to answer, right?
Sorry?
And it is for Leigh. I was thinking about Leigh, Beattie.
Sorry. Yeah, that's really. I mean, I thought the work that Kevin was doing was really interesting, and trying to put some ideas behind that. I think it'd be really good to try and run a comparative study on that in different spaces to see how that actually, how that transpires between those different types of urban environments. I think that would be a really interesting thing to do, and I would be really supportive of doing something like that, to be honest.
Yeah. Okay, then maybe because time is kind of slowly running out, but there's one question, or in the meantime, I think there are two questions from the audience. And maybe Ingfen, do you want to let us know one of those? Yeah.
Yes. Here's a question I think maybe all of you can just jump into answer from your perspective. And there's from one audience, and he or she she's interested about how the working from home should be reflected on the design and access for adjacent open space, particularly in this dense building environment. This can start from small adjacent to one's balcony, roof, to the pocket garden areas, and any adjacent open space. Yeah. So any of you, do you have any thought? You can just answer that.
Well, I can actually share some of my experience. I mean, particularly in the dense built environment, because as you may imagine, in Hong Kong, we tend to live in apartment flats that do not have. Sometimes we do not have balcony. For example, like my place, I do not have a balcony or roof garden, things like that. And then during the lockdown period, I have been staying from home like for, I think, almost a month without going out at all. And then when the situation kind of relieved or getting a little bit better, then we started to go to parks, and then we started to do some individual sports like running along some because there's some hiking trails next to my place, so that I can run a little bit. But we do not tend to go to park. I mean those places with people gather. So I think there's a change, as I mentioned, there's a change in behavior, how you select, the mode of exercising, and how you perform, like, well, physical activity, whatever. And I think there's quite a considerable change in the behavior and voice of how we do things. So I think it's an issue that urban designers may have to take into account in future design.
Maybe somebody of the others also want to answer to that? Maybe.
Have a response. I think it's actually a really important issue, because I think for a lot of the people that we spoke with, they talked about the fact that they felt very confined within their home based on their sort of living environment. And that also, working at home also brought up a number of other work health and safety issues. So not everybody has an office or has an appropriate place to sit and be quiet and think and be able to do the work that they normally do. And as Kevin said, not everybody has access to some sort of open space that they can go and sit outside in. I'm very lucky. I can sit on my veranda if I feel like I need some fresh air, but not everyone can do that. So I think it's a really important consideration if we're going to look at more working at home in the future.
Anyone else? I think our time is about to be up. So I would pass now to Luisa to end this webinar and also announce the next webinar next week.
Yes, thank you very much, Hendrik. Thank you, Manfredo, and thank you to all the speakers for this very insightful conversation. We actually need to talk more about this topic since we will continue till the end of August with our webinars. Probably there will be another opportunity to continue the discussion on health cities. Now, I just want to make a small announcement regarding the webinar next week. As you know, on the second Thursday of the month, we are having the special series of innovative approaches and creative practices in response to the COVID-19 pandemic. And so next Thursday, we will have an amazing panel of speakers from United States, Ecuador, the Netherlands, United Kingdom, Italy, and Australia. We will announce shortly the program of the webinar so that you can register. I would like also to remind you that all our webinars are recorded and that we publish all recorded webinars on the YouTube channel of City Space Architecture. And we are also preparing summaries from each webinar so that you can together with the video, you can read a short description of what was discussed, highlighting the main contents. So that's it from my side, and thank you everyone again for participating, and follow us on the Journal of Public Space. and follow our webinars since this is a major effort, but we believe this is worth it for us, and we believe also for all those who are into public space culture.
Mm-hmm.
Thank you very much.
So thank you very much to all attendees, and of course to all speakers as well. Okay, thank you very much.
Thank you.
Thank you. Thank you.
Bye.
Take care.
Bye.
Bye-bye.
Thank you.